Hi, my name is Rafaele Hunchens. I'm a professor of experimental clinical psychology and the coordinator of the research master track Deficits, Distress and Disorder, or in short DDD. This is a collaboration between 4 departments: clinical psychology, clinical neuropsychology, pedagogical and educational sciences, and psychometrics and statistics. In this team, you will gain a better understanding of psychological disorders. For example, ADHD, eating disorders, and addictions. Not only do we address associations between brain and behavior, but we also use experimental approaches to understand the causal mechanisms involved in psychopathology. And not only do we study specific disorders, we also study key transdiagnostic processes, such as memory and attention. The main focus in my research is on trauma-related disorders and dissociative disorders, including the fascinating disorder of dissociative identity disorder. I study, for example, if these patients remember events experienced by other identities.
I work at the Department of Clinical and Developmental Neuropsychology, and my research interests in psychotic disorders. I do studies ranging from fundamental studies with fMRI to applied treatment trials, for example with virtual reality and sports interventions. And I also am very interested in how we can prevent stigma of people with mental health disorders.
I work at the Department of Clinical Psychology and Experimental Psychopathology. My area of research is in anxiety disorders in children. I'm interested in the maintenance and development of anxiety disorders and also in prevention and treatment. I like to answer questions such as what works for whom. I combine my work as a researcher with work as a clinician at ACARO, which is an institution for mental health for children and adolescents.
In addition, I also work as a mental health care psychologist at GGZ Drenthe, where I work with people with psychotic disorders, and what I do there is, for example, neuropsychological assessment and cognitive behavioral therapy, and as such I do consider myself a true scientist practitioner.
The DDD track can really prepare you for such a career as a scientist practitioner. You can follow a skills course, you can also do a clinical internship, and you can also choose to do your research within a mental health institution and then combine research and clinical work. And if you follow such a choice of courses, then you can also meet all the entry requirements for the postmaster GZ-opleiding in the Netherlands.
Hi, my name is Ante, I'm 25 years old and I've just started my PhD. During the research master, I got the impression that combining applied research as well as fundamental research is sort of a recurring theme here, and that it motivates the researchers, and I really like that. Also, I found my internship quite intriguing, as I had the chance to work with some patient data and got a good impression of a more holistic image of the patient that was actually behind the data. So choosing the research master was an excellent career choice, because it feels like you get a head start on a variety of future positions, like working in a clinic, working in other research institutes, but also the university and perhaps maybe even industry. So for me personally, overall it was a very positive experience and I learned a lot.